Good evening, ladies and gentlemen. My name is Andy Davis. I'm the Neurosciences Manager for SSM Health in Southern Illinois. We're coming to you tonight to discuss pediatric sleep issues and how they can affect your behaviors. We're actually coming to you from one of our sleep rooms on the Centralia campus. And if you can notice, we try to make it as homey as possible and as comfortable an environment as possible. We're very lucky tonight to have with us Dr. Haley Martins, a pediatric sleep specialist, the only one in our region. And so without any further ado, I'd like to welcome Dr. Haley Martins.
Hi everyone. I am Haley Martins. It's nice to virtually meet everyone. So I just want to tell you a little bit about me. So I am general peds. I have a general peds background. So I did residency at UT Austin in Austin, Texas, and I did my sleep medicine fellowship at Vanderbilt in Nashville. And I am now here doing both general pediatrics and sleep medicine, both for kids and for adults. So I was lucky whenever I came, very fortunate to have these awesome sleep labs already in place, and great lab directors like Andy, who helped make this transition to adding on pediatric studies just as seamless as it could be. So we were very fortunate with that. So we've all seen our kids miss a nap, and we kind of know what that's going to look like. We kind of dread those evenings that they miss those afternoon naps, and it doesn't always look like they're going to be sleepy or go to sleep early, although that's what we may wish of that. But it will sometimes, most of the time, looks like irritability and acting out, and really just a kid fighting to stay awake. And so that's kind of on a small scale of things, but when you look at it on a grand scale of a kid not getting enough sleep, it can really look like a lot of different things, and not necessarily sleepiness. So a kid can present with hyperactivity, with behavior problems, difficulty concentrating, learning problems in school, really a lot of different things. And so just sleep just affects quite a bit. So a kid's day-to-day life, if they are missing a lot of sleep or not getting enough sleep, kids will come to me for evaluations for ADHD or learning disabilities or learning problems in school. Schools and teachers are reaching out to families that they're not learning well or need some extra help. And sometimes that may be a learning disability, it may be true ADHD, but oftentimes it can be because they're not getting enough sleep. And that may mean they're not getting enough quantity of sleep, but it could also mean they're not getting good quality sleep. And so that's where I come into play to try to figure out if there is a sleep problem that could be causing these symptoms. So, and then that's kind of our day-to-day lives, our child's day-to-day life, but with their overall health, it really affects things as well. So if a child is having not enough sleep or poor sleep, it really affects their cardiovascular health. A lot of hormones are secreted in the night that get affected by poor sleep, so it really affects a lot. And when our kids aren't sleeping well, we're not sleeping as well, and we can't take the best care of our kids possible, and so everybody needs good sleep. And so that often starts with helping our child sleep. So a little about what does a sleep study look like, and what does it look like? What does that night look like? So you'll arrive with your child around 7 p.m. and we'll get your child hooked up. I often will tell families we'll hook them up like a robot, so kind of put some jewelry in their hair and just get them all hooked up. And while they're getting hooked up, they can watch a movie, listen to a story, listen to music, something that's enjoyable and comfortable for them. And then they'll spend the night. A parent will stay in the same room with them, and they'll get up in the morning and go on with their day. Your child can take all the normal medications that they usually take on the day and night of the sleep study, and they can bring comfort items from home, so their favorite pillow, their favorite blanket. We do have things like weighted blankets here to be able to use, but comfort items from home can often be helpful. Teddy bear if they usually sleep with it, or whatever. And what information does a sleep study tell us? Well, it actually tells us quite a bit. So It'll tell us the different stages of sleep, the architecture of sleep. If your child's going through all the sleep stages and getting the right amount of each stage of sleep. It'll also tell us a lot of respiratory data, and that's one of the main things that we look for and look at. It can tell us if your child is having pauses in breathing, shallow breathing, really any of these kind of respiratory events that may cause your child to have drops in oxygen, and or these miniature arousals or even full wakings that can be some of the source of nighttime awakenings for kids. We can also see movement, so we can see kind of gross movement. Is your child flipping and flopping? Are they kicking their legs a lot at night? And that can be really helpful for us to know. And we can also see a little bit of information on the heart. So it's just a one lead EKG that we do, but we can see, if your child's heart rate is normal throughout the night, and are they having any kind of skip beats, that kind of thing. So it tells us quite a bit of information. And so what kind of sleep problems do we even see in kids? So there are a ton of sleep problems that we can see. The most obvious is insomnia, of course, and that can be either problems falling asleep or problems staying asleep. But this is probably one of the most common things that I see. Problems falling asleep can be anything from anxiety to behavioral. It can also be due to insufficient sleep hygiene, things like drinking caffeine late, things like that. It can also be from sleep disorders like restless legs or pain like teething. Waking up in the middle of the night can be kind of just part of our natural cycle of waking in the middle of the night, but it could also be a symptom of something like sleep disordered breathing, like sleep apnea. So that's something that I try to tease out a little bit, try to figure out why your child is having a hard time falling asleep or staying asleep, and then deciding from there if a sleep study is the right decision or next step that we would take. Apnea is another thing that we very frequently see in kids, and something that one of the main things that we're testing for whenever we do a sleep study. So kids get sleep apnea? Of course they do, and up to 5% of kids have sleep apnea. There's a couple different kinds of sleep apnea. The most common is obstructive sleep apnea, and the most common cause of that is large tonsils and adenoids. We're also seeing increase in sleep apnea in kids with elevated BMIs, obesity, but also any child who has a neuromuscular disorder, some low tone, abnormalities in their craniofacial features, so recessed jaw or high arched palate. There's a lot of different causes of obstruction whenever a child sleeps. And is all snoring sleep apnea? No, but a child who snores is going to be at increased risk of having sleep apnea. So we know they have obstruction somewhere because they're snoring, but is that obstruction causing apnea? They are at increased risk, so if they gain an abnormal amount of weight, it could push them over the edge of having just snoring to having sleep apnea. And do all kids who have sleep apnea snore? The answer to that is also no. So a lot of times people will tell me, well, my child doesn't snore or have pauses in their breathing. I don't think they have sleep apnea. But we actually see it a lot more commonly than we get the answers of, yes, they're having pauses in their breathing. You're not sleeping next to your child. You don't always see them have those pauses or see them have snoring, and it may not always be obvious. So there's a lot of different symptoms of sleep disordered breathing. Some of them we already kind of mentioned, so hyperactivity, difficulty concentrating at school, excessive sleepiness, so falling asleep in the car very easily, things like that. And some of the more apparent symptoms of sleep apnea are snoring, pauses in breathing, those types of mouth breathing, those types of things. But there are also some not so obvious symptoms of sleep disordered breathing, and those can be anything like sweating in sleep, bedwetting. So if your child has mastered potty training and they've been dry for a good 6 months at night and all of a sudden they start bedwetting again, that can be a symptom of sleep apnea. It can also look like morning headaches, and restless sleep is another symptom that you can see. So what other sleep problems can we see in kids? Restless legs and periodic limb movement disorder, or kicking of your legs in sleep, is another common thing that we see. And so restless legs in adults, you have to meet certain criteria to get that diagnosis. Kids can't express these things to be able to get that diagnosis, so it often goes undiagnosed. A child may look like pain or discomfort in the evening before they fall asleep, so they're rubbing their legs or asking you to rub their legs, and it really can be very uncomfortable and cause them to have a hard time falling asleep. So that is something that you can see in children. It is more common in kids who have a family history of restless legs. And one of the main associations of restless legs is actually low iron. So kids who have iron deficiency anemia or low iron stores doesn't necessarily mean they have iron deficiency anemia, but low stores of iron can mean restless legs for those kids, or restless sleep. And so when do I evaluate for that? So if somebody comes to me and tells me that their child's flopping all over the bed or kicking their legs a ton at night, we can look at those during the sleep study. I can also figure out from history sometimes if they're at high risk of having restless legs or low iron stores. So is your child a picky eater? They're not getting in good iron-rich foods, or do they drink a lot of milk, because milk can cause iron deficiency anemia? And so sometimes I'll get some iron levels just based on that history alone. The good news about that is it's a pretty easy fix, and you can see some pretty drastic changes with just adding in some iron supplements. And so that's something that I will often screen for. We also see circadian rhythm disorders in kids, and so most commonly in kids, and specifically in the teenage population, is delayed sleep phase. And so that means a kid left to their own decisions would fall asleep between 12 and 1 a.m. and then wake up between 10 and noon and the following day. That's okay during the summer, but now that we're starting school again, we're really cutting into their natural sleep stages, their natural sleep time, by asking them to get up to go to school. And that leads to kids falling asleep in the early morning classes until they fully wake up for the day. But it's also, again, just cutting out a majority of their sleep time. And REM sleep, or dream sleep, it's kind of where we consolidate our memories. That the majority of that happens in the latter half of the night. And so if we're cutting off that whole chunk by having them go to school when they didn't go to bed until 1 a.m., we're missing out on a lot of those things. So there are a lot of things that we can do for delayed sleep phase. So you can, that's something that we can talk about to try to shift your child's bedtime forward if that is an issue. And there really are a lot of other things that we see in sleep. There's night terror, different parasomnias, night terrors, sleepwalking, confusional arousals. We also see just insufficient sleep, not getting enough sleep time, not having good sleep hygiene. There's also hypersomnias like narcolepsy. So there's lots of things to talk about with sleep. So I am happy to see anybody with sleep issues, whether they be small or large, and kind of walk through what may be going on and try to help figure out how to get the best sleep for both your child and yourself.